Okay. Some of you may know that I am moving to Georgia in about 2 months or so from Rush, but currently I am at Rush. An ASD with small rims, whether small or not, any ASD with adequate rim, whether small or large, is easy defect to close. We all know that. When I was asked to debate on this topic for ASD, small in size and adequate rims, I thought that's a debate that I will win very, very easily. Till I saw the name of the person who I was going to debate against, Dr. Rhodes. And he avoids Zamplatzer devices as passionately as I like to use Zamplatzer devices. And John, he's brainchild of this article which was published about 2 months ago, a strategy for ASD closure in small children that eliminates long-term wall erosion risk. So I know that John's strategy would be that I am going to scare the audience with the risk of erosion so much that they will have to agree with me. I am the mighty. I will twist the audience around like a helix. So Zahid is what's for dinner tonight. Well, Zahid doesn't taste that good, by the way. So I really wonder if I was living in a bubble, having used almost 1900 amp laser septal occluder, having no erosion at all. Maybe I thought I need to get out of the bubble and see what's really happening, and also try to see how I will be able to convince the audience who are scared of erosion. So I will have to do my best to control the beast in every which way, and make the audience think, or some of you even rethink, that I am not the only physician who believes that Amplatzer is a much better device for small ASD with adequate rims. And in doing so, maybe, God willing, convince John as well. So debates like this have many advantages. Attendees are going to learn all the bad outcomes for sure, and almost all great results about the product being debated. The speakers are usually experienced users, just like John is and I am, and well versed with the data. The ideal debate hands will have to the following characteristic. It has to be objective and unbiased. It has to compare apples to apples. It has to discuss, carefully examine, and corroborated data. And the debater does not have any preconceived notions or a strong hate or aversion to the product that he or she is debating against. In addition, the ideal audience will decide in an objective manner, will make determination after listening to the argument, not before. We know there are certain complications inherent to both devices. We also know that we will continue to use both devices as the risks are low. Chance of developing pericardial effusion